It
you
is.
will be motivated and inspired. What I would like to do is introduce my good friend, Vice Admiral Adam Robinson, United States Navy,
It's neat.
for this critical conversation. Dr. Robinson has a great career in medical. He was the 36th Surgeon General of the United States Navy, the director of the Maryland VA system, and he's currently director of Hawaii and Pacific Islands VA systems. Ladies and gentlemen, allow me to present to you my dear friend, Vice Admiral, Surgeon General, Adam Robinson. Admiral?
Tyrone, thank you very much. It was a wonderful introduction, and I'm very happy to be here and participate in what I think is a wonderful conference and a very timely conference. It's timely because COVID is an historic centennial challenge. This is a 100-year event. At this point, and as I'm speaking, we have over 210,000 dead from COVID-19, and we have over 7.4 million people who are infected worldwide. There's no doubt that vaccine is the cornerstone of making sure that we can overcome COVID and also making sure that the global economic health, security, and safety is maintained through a vaccine. Our nation has lots of questions. There are lots of concerns. There are a multitude of health policies, and these are all affecting everyone today, and not just in this country, but worldwide. Rear Admiral Schwartz, you are the Deputy Surgeon General of the United States and one of the nation's top physicians. Would you please comment on this present pandemic?
Hi, thank you, sir, for that very, very kind introduction. And I really want to let everyone know that I'm honored to be here with you all today. This is really important for us to discuss this critical topic of the intersection of COVID-19 and how we can empower our minority communities. As a woman of color who happens to also be in STEM, this conference personally resonates with me. I really do want to share with all of you what the Office of the Surgeon General actually does. The primary role of the Surgeon General is that he is the nation's doctor. The Office of the Surgeon General is focused on promoting health, helping to prevent disease, and we want to lead with science. Now, our office's goal is to provide our citizens with the most current scientific information to help them build health resilience, combat illness, and injury. One of the office's top priorities in the is the COVID-19 pandemic. And this has impacted all of us deeply, in particular, minority communities. The statistics makes this absolutely abundantly clear. American Indians and Alaskan Natives and African Americans have been hospitalized at rates 5 times higher than white people. Hospitalization rates are 4.5 times higher for Hispanics compared to white people. What we have observed in COVID-19 are the significant gaps in both equality and equity in communities when it comes to social determinants of health. When we speak of COVID-19, we usually talk about health care. While health care is critical, we know that health actually begins at home in communities that are designed to provide income and financial security, education, and access to transportation. Healthy communities are free of cultural and institutional barriers related to race and bias. We also know that prevention of disease is a critical part of staying healthy. And part of obtaining and maintaining good health is receiving regular vaccinations. By getting a vaccination, you are helping to prevent yourself from becoming ill, but also halting the spread of contagious diseases in your community. The United States vaccine development strategy, Operation Warp Speed, which you'll hear about, plays a critical role in preventing COVID-19 infections. And part of in developing vaccines, we need to have minority populations at the table. Specifically, we need minority and female participation in clinical trial studies. These populations have historically been underrepresented in research. All populations must be involved in the vaccine development process, as everyone should be vaccinated. As part of vaccine development, we must ensure that the vaccine works well across the spectrum of diversity. However, we also know that vaccine development and production are only the first steps. Ensuring that all Americans have an equitable opportunity to receive the vaccine and combating vaccine hesitancy will be the key towards achieving degrees of herd immunity and ensuring the protection of Americans against COVID-19. While many partnerships and collaborations have existed for decades, the pandemic has forged stronger, more efficient, and more effective teams across agencies, regions, and borders. I truly believe that the traumatic lessons of COVID-19 will make us all stronger and better equipped to meet future challenges. While the pandemic has been an immense challenge, and there's still much to learn about this novel virus, it's important to know the incredible rate of scientific discovery in the last 8 months. We know more about who is most at risk and why, as well as how to protect them. We know much more about how to treat those most severely impacted. We know that we must address the underlying drivers of disparate outcomes, the social determinants of health, like housing, access to nutritious foods, and childcare that can limit one's ability to make healthy choices. We know what works to keep people and their communities safe, and we've launched a messaging campaign to spread this information to the public called #COVIDStopsWithMe. And you can view this on the Surgeon General's Twitter account at surgeon_general. And we know that it will take partnerships across occupations, geographies, and cultures, religions, and more to defeat a global enemy like the coronavirus. It is truly an honor to serve on this panel, and I look forward to receiving your questions. The United States vaccine development strategy, Operation Warp Speed, sir, we can't hear you, plays a critical role in preventing COVID-19 infections. And part of in developing vaccines,
Thank you, Dr. Schwartz, for your wonderful remarks. And remember, technology is a formidable thing, so sometimes you're muted when you shouldn't be. But wonderfully, I have people that are letting me know that. I have a great panel here today. And General Perna, I'd like to hear from you regarding your remarks and also what is happening with Operation Warp Speed. General Gustav Perna, please.
Admiral Robinson, can you hear me all right?
I can, sir. Thank you very much.
Great. Well, first of all, thank you very much for allowing Operational Warp Speed to participate here today. Thanks to you, Dr. Taborn, and of course, General Johnny Wilson for connecting us all. I think, I would say first and foremost, what an honor to be with you and to join this very distinguished group of panelists as we talk about, as earlier mentioned, really something that's just quite historic. And we need to be all in together to solve this problem. So I'm very grateful for that. I have the unique opportunity, truly a pleasure, to co-lead Operational Warp Speed with Dr. Moncef Slaoui. It is a Herculean effort to develop and deliver safe and effective therapeutics and vaccines to our nation, so that we can just take a good chunk of the virus, just attack it and really get it behind us. Of course, vaccines and therapeutics are only going to be one part of the fight against coronavirus. We have to, still maintain diligence in personal and professional discipline, as Rear Admiral Schwartz alluded to, as we go through this battle. I just would say to you that one of the reasons why I feel just so excited to talk to this group of people is because we are 100% committed in transparency and accountability in the process that we're working through. We want to communicate as much as possible to anybody that would like to hear from us, so that we can assure them and hopefully instill confidence in them that what we're doing is just really incredible work, but with the foundation that we are not going to cut corners. We are going to ensure that we are doing the right things to deliver safe and effective therapeutics and vaccines. So with that said, quick four comments. One, Operational Warp Speed's mission with respect to vaccines is to deliver safe and effective doses and or regimens, depending on if it's a 2-dose vaccine or a 1-dose vaccine, for the American people, all of the American people. We work every day to accelerate the development, manufacturing, and then eventual distribution and administration to all persons in America. And it is driving us all on the team to that end state. I would also tell you this is a whole of America approach. It is not one organization. It is not one title. It's not one group of people. It's all of America. It's being co-led at the federal government level by Health and Human Services and partnered with Department of Defense. And together, the wonderful, talented scientists of Health and Human Services and their logisticians are working every day to bring us a safe, effective vaccine. The Department of Defense is collaborating, bringing structure, accountability, management, skill in planning, and of course, our ability to mass capacity to support things like distribution as required. But then we're also reaching out and doing great collaboration with, of course, commercial industry, whether it's the actual development of the vaccine, 6 companies, which Dr. Hepburn will talk in a little bit more detail, and or the distribution capability that we're going to utilize. Commercial industry is really stepping to the plate. I would also tell you that we're receiving a lot of help from academia, in that they're helping us to see things differently, take innovative approaches, help us venture into places where people didn't think were possible, and it's exciting to talk and learn from them every day. And then, of course, last but not least, both the intricate and integral part of our success will be working with the state and local governments as they truly understand the communities and how we can best, at the end of the day, deliver and administer the vaccine to everybody. The third thing I will tell you is that we are being driven by science and data as we develop the vaccines and manufacture them. And I can assure you that we will not get out in front of science, the FDA's final approval. They are an independent organization that will go through very high and rigorous standards to ensure that the vaccine is safe and effective for the American people. And you have my personal word that I will not approve distribution without the FDA approving the vaccine. And I'm sure there'll be more questions on that, but I just wanted to tell you that personally. Before I get off the stage, the last thing I would like to highlight, I thought Admiral Schwartz was magnificent in her opening comments. She brought up about the support of all persons, all communities in what we're doing, primarily with the clinical trials, but eventually in the final acceptance and administration of the vaccine to every person. Two things. One, we need your participation so that we can, in the trials, so that we can show the all communities, all ethnicities, that the vaccine is safe and effective. So that's number one. And then number two, we can develop, we can manufacture, we can be ready to distribute the vaccine, but if people don't have confidence in it, and if they don't want to take it, then the vaccine is worthless. So we want to make sure that, we're communicating, we're transparent, we're telling you we're holding ourselves accountable, but we want to do whatever we can to instill confidence in you that the vaccine is really going to be safe and effective, to the point where I am incredibly confident in what I know right now. And I am an advocate, and I've asked my mother to register in trials because she is elderly. And I will feel very confident at the end about my 3 granddaughters taking the vaccine. And so that's where I'm at, and I just wanted to pass that to you. So Admiral Robinson, that completes my comments. I'll wait for questions following Dr. Hepburn. Over.
General Perna, thank you very much. Very timely remarks, and also your assurances are well received by us and actually by the entire United States. Dr. Matt Hepburn, who's working with General Perna, is one of the world's top vaccine experts. And what message do you have, Dr. Hepburn?
Good morning. Like the previous speakers have said, what a privilege to be part of this today. I do have a few key comments answering really a fundamental question of this concept of how can you take a vaccine development process, which normally takes years or even a decade or more, and compress that into a period of months. We get that question very routinely. We are, as General Perna emphasized, doing our absolute best to be very transparent and to communicate to the public on how we are able to achieve that, to go from years to months, but still make sure that all of the quality and regulatory safety and effectiveness standards are being met. Monsef Slawi and myself published in the New England Journal of Medicine a perspective piece that actually covers this in more detail. So for your audience, encourage you to take a look at that. But I will say it's actually fun to present this at a STEM conference, because one of the ways that we have been successful in doing this is science and technology investment. I mean, this is really a good news story for the next generation of scientists, and especially those scientists that are on the phone and participating in this meeting. I mean, the work that you're doing now, especially the young people, you may say, well, I don't know if that's ever going to make an impact. One of the main reasons we're making so much progress on vaccines is all of the science, all of the investments in vaccine development that have occurred over the last 15 years. My previous job before this one was actually at DARPA, so I was very involved in those early breakthrough investments, and we worked a lot on vaccine and antibody technology, frankly, for this day. And we worked with companies like Moderna, which is making vaccines through an RNA technology. That technology is new, But what seems to be turning out, and you can certainly see the publications on it, is that it's a technology where it's safe, it produces a strong immune response, and the publications are there. But it also allows us to make a lot of that product in a very short period of time. And I bring this up because that is one of the most crucial answers, that when we understood the sequence of this virus on the 23rd of January, it actually alerted a series of basic development in vaccines and basic developments in antibodies, and truncating a process that would normally take, let's say, a year before you were ready to do your testing in animal models, to a period of a few weeks, to that type of testing in animal models. And we're very proud of it. I think it also bodes well for our future. I sometimes make this point, and sometimes I forget it, but for a STEM audience, they have to hear this. Why I'm so hopeful about what's happening now in Operation Warp Speed is that we're imagining a future where if you can make a safe and effective vaccine in a period of months instead of a period of years, just imagine what that can also be used to address so many other global health problems. Tuberculosis, newly emerging infectious diseases. I do feel that if we can show how to be successful in this process, it can be applied for many global health challenges once this pandemic is over. Again, back to the question of how can we be safe, how can you make a safe and effective vaccine in a period of months instead of years? We've highlighted the first point, which is vaccine technology. The second point is manufacturing at scale. This is a first part of saying we're going to invest in making large quantities of vaccines much earlier in the process. Typically, the process is sequential. In this, we've made decisions to do things in parallel. Now, it does mean we may be making doses of a vaccine that ultimately isn't proven to be effective, and then we'll throw away those doses. It's that financial spending, but it's worth it because lives are at stake and minutes and days counts, and that's our mantra at Operation Warp Speed. But I also highlight that there's been quite a bit of magic, and for those of you that have served in the Department of Defense or are currently serving in the Department of Defense, I think you understand. And I'm a retired after 23 years of service, so from the Army. So, the Department of Defense does really well at operational planning, and especially at things like logistics and supplies and equipment. When you take that know-how and you put it towards how can we manufacture at scale, and when they say, well, we could make millions of doses, but we don't have the right supplies, and that's going to take 6 months. We've got the best, frankly, I think some of the best people in the world to solve that problem. And it's allowed us to accelerate manufacturing timelines at an extraordinary speed. My third key issue and how do we accelerate is with clinical trials. And I do want to highlight that the enrollment in large clinical trials is a key issue, and I know we're going to have questions and a robust discussion about this. But suffice it to say that for a typical vaccine trial, you may recruit 5,000 volunteers or 10,000 volunteers and look to see over the course of a year or so to see if that one's effective. What we've done is for the vaccines that we are partnering with the private sector, these clinical trials are at least 30,000 volunteers and sometimes more. And why that number, I think, resonates is that the operative word is volunteers. So we have, for our Moderna clinical trial, approximately 30,000 volunteers enrolled. Pfizer, which they also, and Moderna and both Pfizer publish these things online. Pfizer now is in the neighborhood of 35,000 plus volunteers enrolled. But I say again, I think one of the things, frankly, I'm very proud of is people willing to roll up their sleeves and say, I will participate in a clinical trial. And some of those people, by the design of these clinical trials, will be receiving a placebo, and they understand that. They make that choice. and we're going to talk, I hope in this panel, that we talk a little bit more about how do we make the opportunity available to all Americans to be able to participate in these clinical trials. But I think we need to emphasize that that is ultimately a voluntary and individual choice. But I hope as we message this, that we can find ways to praise those Americans who decided to, again, roll up their sleeve and participate, so that we can have the absolute most rigorous evaluation of the safety and the effectiveness of these vaccines. My final and fourth point on how we go fast is teamwork. And I think you've heard the General Perna certainly and Dr. Schwartz convey the teamwork that's occurring in the United States government with our private sector partners, and I would say with our entire community. But that teamwork is why we're here too, that we are looking for you to help us communicate about what we're doing with these vaccines, help us to explain how we can go fast, encourage people to read the publications and the publicly available materials which we are sharing on the safety and effectiveness of these vaccines. Let me give you a very specific example, and then I'll turn it back over to Admiral Randolph. I was on a call with some of our clinical research sites who are actively recruiting right now for another one of our vaccines for the Janssen clinical trial. And what they mentioned was that we always say, how can we help you be successful? These people that are these professionals working very hard to run these clinical trials. And what they said was, well, at a national level, if you can communicate these messages, clinical trials are important. We thank volunteers. We want to make those opportunities available for all. And they said, it works. They said the Surgeon General, who has been very active in communicating, encouraging participation in these clinical trials, they've said, we notice a tangible increase in recruiting when the Surgeon General is giving messages both at the national level and when they visit a certain region or a certain sites. That's where we need your help, and certainly look forward to the discussion and the questions. Admiral Randolph, I'll turn it back over to, or Admiral Robinson, I'll turn it back over to you.
Fine, thank you very much. I was trying to find Admiral Randolph, but he left and Robinson's here now, so no problem. Dr. Hepburn's very good, and I appreciate your comments. Our next panelist is Dr. Thomas Leviste, who is an expert in health policy and healthcare disparities. And I would like for him to say a few words to the public and also give some words to us today. Dr. Leviste.
Thank you very much. And again, thank you for the invitation to participate in this important conversation. Early in the pandemic, back in February, when we were just in the early stages of the outbreak that really overtook, my state of Louisiana, we began to see data on who was dying of this pandemic. Louisiana was the first state to release the data by race, and that data showed that 70% of the deaths were of African Americans, while African Americans comprise about 32% of the state's population. The governor established a task force and asked me to co-chair that task force. This is the governor's task force on COVID-19 and health equity for the state of Louisiana. Other states now have formed similar task forces, and we're now organizing across states to communicate around response to this pandemic at the state policy level. As the data became more refined, we found that the number actually wasn't 70%, it's actually closer to 52% of the deaths are African American. But even at that, the disparity is still striking. And the disparity is similar to disparities we see in other disease categories, such as chronic diseases, accidents, injuries, homicide, you name it, pretty much you see a disparity. I think this audience is probably very well familiar with this. During that period in the spring, communications became a big part of this story, in that there were myths, false, inaccurate information, in some cases intentionally targeting African Americans, but certainly communications and misinformation has been a huge problem throughout the pandemic. Early myths were that African Americans were somehow immune from COVID-19. How exactly that would be, I'm not quite sure how the science would work, whereby skin color would protect someone from a virus. But that myth permeated the community and may have led to delays among some African Americans in taking the virus seriously. Other communications issues, that I'm going to say a few words about, are also a part of this, a part of the problem, a part of which driven the 200,000 plus deaths. The explanation for the disparity early on was that the disparity in race existed because of underlying health conditions among African Americans. And there was communication about African Americans needing to do a better job of taking care of themselves, because the deaths were occurring because of higher rates of hypertension, obesity, diabetes, asthma, COPD. I mean, you know the list. Now that we've learned more about it, we've come to know that that is not the reason for the disparity. This was, to me, that explanation never rang true, because we also have very high rates of hypertension, diabetes, obesity, and so on in the white population. We have a high rate, especially here in the South, we have extremely high rates of those diseases in all populations, all racial and ethnic groups. And while African Americans do have a higher rate, the disparity between African Americans and others was not nearly big enough to justify, to explain how those disparities could be producing such a major disparity in COVID-19. So over time, we've now come to learn better that African Americans are no more or less susceptible to death from COVID-19, and that the problem here is not so much a problem of biology or genetics, but a problem of sociology and economics. That the issue isn't who is dying from the disease, but rather who is infected, and that the infection rate appears to be dramatically higher among African Americans, as well as Hispanics and Native Americans, largely because of occupations that they're more likely to be in, more likely to have an occupation that does not allow them to work from home on Zoom and still collect their full paycheck. In fact, these ethnic groups are more likely to work in occupations that make it possible for people to work at home on Zoom and still collect their full paycheck. So the economic impact has been huge as well, because African Americans, as well as Hispanics and Native Americans, are more likely to work in occupations that have been dramatically impacted by the pandemic. Operation Warp Speed is a truly remarkable accomplishment. Just to be in phase 3 at this point with these vaccines is an absolute remarkable achievement, even if the phase 3 trials don't ultimately bear out. Typically, it would take more than a decade to get to this point, being this close to actually deploying a vaccine. But one important part of this process that may not be receiving as much attention as it should is communications. That the health communications around the pandemic on multiple levels and from multiple actors, no one in particular, but multiple actors, I think has been problematic. The words that we use, the terms that we use, and the communicators that we've been using are not necessarily going to be the most effective communicators to address the issue of mistrust that is rampant in the nation, and in particular among African Americans, who surveys show the majority of whom indicate they will not accept the vaccine when the vaccine is ready. This is a huge problem because, as everyone on this call knows, a vaccine will do nothing for this pandemic. The vaccination is what is going to make the difference. And if we can't get people to agree to accept the vaccination, we will not have a large enough proportion of the population vaccinated in order to create the herd immunity that we're going to need. So as we go forward, I think we need to be very careful in the words that we use and how we describe what we're doing. And I'll give just a couple of examples of health communication choices that I would say were suboptimal. And I'll start with the name Operation Warp Speed, which emphasizes the speed at which the vaccine is being produced rather than the accuracy, rather than the rigorous process that is being observed. And the fact that there's an emphasis on the speed, which is absolutely an impressive accomplishment, I'll stress that. To emphasize the speed rather than the carefulness, the care that's being taken in creating the vaccine only serves to increase the distrust and reduce the likelihood that people will accept the vaccine. The terminology social distancing. Social distancing is not an accurate description of what we're asking people to do. What we're asking people to do is to be physically distant, not socially distant. Moreover, the last thing we could possibly want is for Americans to become more socially distant, when what we need right now in this great threat to our society is more social connection. So we want to be physically distant, but we want to be socially connected. And as we go forward, I think it's important for us to pay attention and heed the communications and the terminology that we use, the messaging that we use, that we can alleviate the mistrust and have people more willing to do what we are going to need them to do when the vaccine is ready, and that is to accept the vaccine and incorporate it into their medical regimen. So I'll stop there and look forward to engaging any questions that you may have for me.
Dr. Leviste, thank you very much. And I must say that you bring in 2 points very quickly, and that is vaccine, but vaccination. And I got that. And then the sociological and economic, which is another twist on the problems that we have, which will make a huge difference in how we can get ahead, if not with this particular crisis that we're in now, but ahead is where we're going. We have questions now, and I'd like to address the first set to Dr. Schwartz, Deputy Surgeon General. General Johnny Wilson, co-founder of BEYA Stars and Stripes, asks, why are the events like this important to the federal government? Dr. Schwartz.
Thank you for the question, sir. It's really critical for individuals to hear from people who look like them, who've spent their careers in the federal government. This really helps to build trust. It helps individuals understand what the federal government is doing for them in their daily life. And additionally, when you think about it, minority health and health disparities are truly important aspects of the Office of the Surgeon General and what I represent as a United States Public Health Service Commission Corps officer. Through our work in the Office of the Surgeon General, we truly aim to connect with audiences from a diverse background across the country. We live in a diverse nation and the world, and our work in public health should represent this.
Yes.
We truly need diversity and representation in not only government and STEM fields, but we also need this in leadership positions. Now, we know there's been an increase in the number of professionals who are people of color and women, but there's often a bottleneck when it comes to leadership and executive positions, and I personally have experienced that. So for those of you who are listening out there, if you're working in a healthcare field or a public health field, I just going to put a plug in here, and you're interested in providing a public service on behalf of our nation, I really urge you to consider joining the United States Public Health Service, the Commission Corps. It's a service that I represent, and there are 6,100 incredibly strong public health officials out there. Back to you, sir.
Thank you, Dr. Schwartz. That was very good. And the next question comes from Admiral Walt Davis, who is the BEYA Chairman. I should say the BEYA Stars and Stripes Chairman. His question is, many families have been negatively impacted by COVID. What advice do you have for children who want to become disease fighters?
So the Office of the Surgeon General, we've been emphasizing that our best and immediate defense against COVID-19 are basic public health preventive measures. And the Surgeon General likes to call them the 3 W's. Number 1, wash your hands frequently and thoroughly. Number 2, watch your distance. I don't want to say socially distance, Sir Thomas. I want to make sure I say watch your distance, your physical distance. Stay at least 6 feet away from others outside your household. And number 3, wear a face mask to protect yourselves and others. These 3 simple measures can truly lower the person-to-person spread of disease. And children should receive routine vaccinations as well as their seasonal flu vaccination. We need as many flu fighters as possible. Also, as many teenagers have social media accounts, please encourage them to spread the word about the importance of getting their vaccination and their flu vaccination. It could even be considered a form of activism or civic engagement. Additionally, kids can find ways to be active, whether it be yoga, playing soccer with their siblings, going for a walk with their family. I would encourage them to promote their healthy and fun activities on social media. Good habits will keep our future generations healthy and resilient.
Dr. Schwartz, thank you very much. To General Perner and also to Dr. Hepburn, this question comes from Tommy Dortch, who is the chairman of 100 Black Men of America. What is the traditional time frame for a new vaccine to make it to the market? And he asks, how was this particular process accelerated? And I know, Dr. Hepburn, Dr. Hepburn, that you, in fact, discussed this a bit, but could you just talk about that just a few minutes? That is, the traditional timeframes for the vaccine and how this was accelerated.
Hey, Matt, I think best for you to work that over.
Happy to do so, sir. Yes, and certainly appreciate the question, and also appreciate the dialogue so far. I think the reason, General Perna and I are here today is we are really trying to get the message out on that. Although we're going fast, it is a safe and effective vaccine. I think it's very meaningful for General Perna to, personally assure that, and I personally assure you as well. I hope this group can kind of convey that. You're leaders in your communities. And we get out there, we talk, but I think as well, we're encouraging the companies to publish their information. This is a STEM conference, so go read the papers, look at the phase 1 data, the safety and efficacy, look at the those types of public communications in peer-reviewed journals. I think also hopefully create that scientific message that we are, again, we're not cutting corners. We are ensuring that these vaccines are safe and effective. I do think it is helpful to note, though, too, that this is it's truly an effort of literally thousands of people working on this. I think one of the, and I think that's appropriate for the level of how do we address this pandemic. But the Operation Warp Speed team, I mean, we're composed of what I would say some really great people, the best, if you will, from the Department of Defense. I mean, again, think about a 4-star logistician in charge of one of the most complex logistic operations in the entire world is leading our operation. But we also bring in the expertise from the National Institute of Health, the Center for Disease Control, and other groups in Health and Human Services. Like it's literally hundreds of people just on the federal government side of things. And you couple that with the private sector with thousands of employees. You couple that with thousands of clinical research professionals that are enrolling patients on a daily basis. Part of why we are able to accelerate this timeline is that the leadership has told us to focus. The leadership has marshaled the resources and the strategic direction. And now I really do feel like this whole of nation approach is moving out to make these things happen. So let me turn it back over to you, Admiral Robinson. I hope that answers the question.
Thank you, Dr. Hepburn. It does, and I appreciate your answers. I have one more question for you, and that is, Dr. Lovell says that African Americans are leery of the vaccine, and they may not take it, according to surveys. I shouldn't say he said that. He just cited some surveys. What percentage of Black citizens are presently in clinical trials? Can you tell me that?
Yes, and this is published on the for the Moderna and the Pfizer trials. Those are the two trials that have recruited 30,000 patients or more. This is publicly available. So Pfizer on their website, I think, has 8% African Americans, and the Moderna clinical trial is right now. It's not completed enrollment, but it's at approximately between 8 and 9%. In terms of African Americans. The Moderna trial as well, in terms of Hispanic or Latinx populations, is I think in the neighborhood of about 18 to 19%. I think but I'm really glad you brought up the issue. I think there is, it's extremely complex. When we talk about communicating health information clearly, and I'm glad that's been a central issue of this dialogue. We need to try to communicate. We need to communicate clearly, accurately. That's why we're here today, so that you can help us communicate about that. I think there is a lot of mistrust about vaccines in general. I think there's a lot of mistrust about clinical trials. So to address that, I think we have to be thoughtful. We have to be balanced. You can't. You heard me emphasize it. I want this. I feel very strongly about the fundamental concept of volunteering. That people complete informed consent. They truly understand what they're doing when they participate in a clinical trial, and we need to always emphasize that. But I think we also have to couple that with making opportunities available. And opportunities meaning people are well informed so that they can make the decision if they want to participate. And that's where the outreach to these communities, to all communities, is so important. But I think in particular, and this is why I cited the example from our US Surgeon General, national messaging on clinical trials, and here they're important. It has a huge impact. But we're also working at the community level, and our National Institute of Health have had a very deliberate and I think, and hopefully effective program that's occurring at our clinical trial sites to encourage participation with all communities in the clinical trials, but especially reaching out to communities who haven't traditionally participated in clinical trials as much.
Oh, shoot. What time does that show?
Thank you, Dr. Hepburn. I want to pose this question, and I will just make a note. We're getting close to time, but we still have a few minutes left. But Dr. Lovell, as an expert in this field and as someone that has brought up some very cogent and valid points that need to be addressed, what question that you think people want to know have we not covered at this point in this particular dialogue this morning? So I would just like to have you think and then ask a question that you think we should be asking that we may not have.
I think the biggest question, the most important question, was addressed in this session, which was, how is it possible that vaccine development, which typically would take more than a decade, can be condensed into a matter of months? And I think getting that message out to people, I know I've heard it many times and certainly have been in conversations and meetings, but I think the general public needs to understand that the speed at which Operation Warp Speed is occurring is not occurring because they're cutting corners, but rather because instead of using a sequential process of development, some things are being done simultaneously. That is so important to get that information out to people, for people to really understand that. And I don't think that people really get it. The other aspect of it is, I think, is who is the messenger. I think that you need to have more trusted voices speaking to people. And, you know, I I don't certainly would never want to be insulting of anyone, but I don't know that the people on this call, including me, are necessarily trusted voices in the community. It needs to be people that people in the general community trust and believe are doing things and saying things that are in their best interest. I don't know that the government employees are the best messenger there. So that would be my comments.
So to the this is back to General Perna, Dr. Hepburn, and actually you too, Dr. Levis. And that is, but I just want to ask a couple of economic questions regarding vaccine and also vaccination. But the vaccine, is it going to be affordable to everyone? Will insurance companies cover it? And how will it be distributed? In other words, what agencies will actually distribute the vaccine? In other words, how do I go and get my vaccination? So Dr. Hepburn, perhaps you'll start, and General Perna and Dr. Levis, please come in when you want.
Hey, Admiral, this is General Perna. Let me start and go and pass it over from there. So the intent, and it's been expressed by several of us at the leadership positions, is that the vaccine will be no cost to the American people. The government has already paid for the development, manufacturing, and distribution of the vaccine, and now we're just trying to codify in writing that the dollars required for administration at the vaccine sites will be covered, and we feel very good about where that is. I just left Secretary Azar's office, and the conversation was about making sure no cost to the American people. He's in full support of that, and that's where we are as we speak right now. Second, to the distribution, so we're going to have tens of millions of doses of vaccine, we believe, we're still waiting for trial results, of effective vaccine, November, December timeline, tens of millions. We think that number will increase exponentially January, February, March, April, so that we have enough vaccine for everybody in America, no later than April. And so what that means is as 5 of the 6 vaccines require 2 doses, with the 6th one requiring only 1 dose, we have to set up a distribution system that can do 4 things. 1, we have to be able to track it, where all vaccine is at all times, 24 hours a day, 7 days a week, from manufacturer to put it into the little vials, to distribution, to arriving at the sites. 2, we must be able to make sure that we know who received the shot and where, because there'll be 6 different vaccines that'll be out and available to people, not all at the same locations. So what will be essential is if you go to one location, which I'll talk about in a minute, and you get vaccine X, when you go back for your second shot, you have to get vaccine X again. And so what we want to be able to do is track that and make sure that you get notifications of the second vaccine and that you get the right vaccine. Third, we want to be able to track execution of the vaccines, in other words, actually being administered, so that we can keep the flow of vaccine coming out to the American people in a timely manner. We don't want to overwhelm the system, put too much, and it's not being used, or too little. So it's really, we have to manage that accordingly. The 4th tenet is we need to be able to cover all of America. Now, we're primarily going to go through big pharma, right? We all know those as CVS, Walgreens, Walmart, right, etc., doctors' offices, hospitals. But we also want to be able to cover other areas like nursing homes and remote places of where people are living outside of major communities. So very complex problem, but we're working through that. Distribution will be done by normal pharmaceutical transportation companies that are well-versed on how to maintain, account for, and distribute throughout America. They will pick it up from the distribution centers of the manufacturers, and they will deliver it to the administration where you actually get the shot as we direct. And then persons, based on several categories that we're working on to be determined later on in the decision cycle, categories such as elderly, first-line responders, first-line medical persons, etc., will be defined after we understand the safety and the efficacy of the vaccine. And that recommendation will come from the director of the CDC, and we will distribute accordingly to that end. So that's a lot. Real quickly, I'll pause, and then, Admiral, if okay, we turn it over to Dr. Hepburn for a comment. Over.
So this is Admiral Robinson again, and what I'd like to do is, because we're getting shorter time, I'd like to give the audience a chance to have some questions. So the first question is this: women represent 70% of global healthcare workforce, yet only 20% of the leadership roles. What is the best solution to solving this dilemma? We cannot solve these problems without women. That's why we have this conference. So can Dr. Levis, can you give your opinions regarding how we can improve the amount of women who are in global healthcare workforce?
Absolutely. I think that the way we do that is, well, first through conferences like this, by showing young girls that there are women in these fields, that there is a place for them in these fields, that there's a future. Making sure that they know about the process of getting, mentored into that training, and at their institutions. And here's my opportunity to plug my school that I'm dean of, the Tulane School of Public Health and Tropical Medicine, where we train people to do this very work, not everything from vaccine development to health communications. I think it's a matter of making sure people understand it. And I think that we have, in the last few decades, there's been a dramatic improvement in women going into these fields. And I think that we just need to continue along that line.
Thank you very much, Dr. Levis. For this is Dr. Hepburn, or even Dr. Schwartz. How will the government prioritize who will receive the vaccine in the initial phases?
Yeah, I'm happy to actually turn that over to General Perna as well. Our Operation Warp Speed is focused primarily on delivery. The consideration in terms of who gets the vaccine is obviously a policy issue that needs to be made with a lot of senior level officials kind of weighing in and thinking about. There's a lot of significant implications of that. But I will draw your attention to a couple organizations. The first is that there's a National Academies of Medicine report that recently came out that describes exactly that question in terms of what are the ethical and societal considerations on who should get vaccine first and how a prioritization scheme. It was a really excellent consensus report that diagrams a construct where we can think about that. The other is the ACIP, which does immunizations practice and makes recommendations for all sorts of vaccines, like childhood immunizations as a good example. They're intimately involved in that process. One of the challenges for us is that as we're doing these clinical trials right now, we're going to learn where does the vaccine work best. What I mean by that is, what we're hoping as example is that the vaccine will be as protective in older adults as it is in younger adults. I think everyone is aware that's not always the case. But as we learn more about the vaccine, it feeds into this, both a policy process and the scientific process, so that we can come up with the right prioritization. Turn it over to General Perna for further comment.
Admiral, I have nothing to add to that, with the exception of the vaccine's going to be available to everyone, and we want science and the data to drive what vaccine is best for what groups. Over.
Thank you, General Perna, and also Dr. Hepburn. The question of vaccines, the question of how we're going to distribute it are certainly being answered. The questions of how we're prioritizing it are certainly there. And the questions of how we communicate this is of paramount importance. I would just like to open up to Dr. Schwartz or Dr. or Dr. Leviste. Are there do you have any comments? Are there any other areas of concern as we're coming close to the wrap up of this particular segment that we need to be looking at? Dr. Schwartz first.
Hi, I think, that we've really addressed a number of the issues of concern. As an African-American female, I can tell you that, speaking to my own family members, there still is just a lot of misinformation out there. And I think it was really clear when we talked about who are those trusted leaders and who are those trusted community leaders that can speak to members of our community so that people can truly believe and have faith in the process. So I think really getting out the word that we need community leaders to be there front and center, whether it's in our churches or synagogues or wherever, we need to be able to have people who can speak science, but in a way that people can understand and that people can believe and trust in the vaccine. Back to you, Doctor.
Mm-hmm. Dr. Schwartz, I'm going to press you just a little bit harder, and that is, how do you think we should approach our underserved communities, the ones that really are at the economic and sociological disadvantage, so that they can understand the health and the disease implications, and we can make this something that they can trust? Do you have any thoughts regarding that? And Dr. Leviste, you too, if you have a comment.
Yeah, I can tell you, as the community-based testing site lead for HHS, one of the most important things we did as we were establishing these COVID-19 testing sites throughout the United States, we've done over 2.5 million tests in the nation, was that we wanted to go to those socially vulnerable populations. We looked at communities in need, specifically using the CDC Social Vulnerability Index, so that we could look and go to those communities and talk to them about why it's important to get testing done. And so we talked to the community leaders, and we did exactly the same thing that we did with testing, we should do with the vaccination program. And it's so refreshing to hear General Perna and Dr. Hepburn talk about using those community partners for vaccination. I mean, the Walgreens, the Walmarts, the independent pharmacies that are in the communities, these underserved communities, they are trusted partners. And I think in doing that for testing, we should do the same thing for vaccination. And that it worked wonderfully for testing, and I think it will work wonderfully for vaccination.
Admiral Robinson, Ty Taborn here. Very quickly, while we're doing that, I think it's equally important that we reach out to some of the leading organizations, such as the fraternities, the Boulay, the minority veterans groups, such as NOAA, the ROCs, all of these folks that have a tremendous amount of credibility in the community, and that these kind of conversations are taken at that level. It's just absolutely critical as we move forward with this.
Yeah, I think Tyrone just stole my thunder. I mean, I think those are the trusted voices that I think are going to make a difference. The National Medical Association, the Black Nurses Association, Association of Hispanic Physicians. I mean, these are the types of organizations that are going to really get people to trust. If the National Medical Association came out and made a national statement saying, as Black doctors, we believe in this vaccine, we would recommend our patients, we would recommend our family member to take this vaccine, I think that would have more, that would move more people than any other trusted voice, certainly in the Black community.
Thank you very much, Dr. Levis. And also, Dr. Taborn, thank you very much for those comments. And I appreciate it very much. As we're moving closer to the end of this, I'd like to just make a couple of comments as we're closing out. And that is, I'd like to thank General Perna, Admiral Schwartz, Dr. Levis, and Dr. Hepburn for their most impressive presentations. And the impressiveness is not just in the information, but it's also in the forthrightness that you have presented it to us, and also the pledges that you have made, General Perna and others, to making sure that we do not just the right thing, but we also do what is right. So I appreciate that very much. The second is the making sure that we can communicate and having trusted voices. Dr. Taborn, Dr. Levis, bringing in the National Medical Association, the boulets, the fraternities, the sororities, bringing in the social partners and the social fabric of the nation and the underserved communities in particular goes so far to making sure that we can get the message at the right place. And may I also just add, we need to bring in our church and religious organizations to make sure that we get that word too, because they need to be involved in this and they need to make comments from their pulpits to make sure that people understand. I'd also like to thank all of you, General Perna, Admiral Schwartz, Dr. Levis, Dr. Hepburn, for your timeliness in your presentation this morning. And I'd also like to thank you for helping us to understand the preparedness that we need to attain in managing this pandemic, because as we develop safe vaccines and as we develop safe and effective vaccination processes, we can therefore make sure that our global health, our global security, our global economic and public health effectiveness is intact, and that is the major mitigation strategy that will be the entree to making sure that we can reach everyone, not only in this country, but the world, who may need to have this particular vaccine and the particular service that Operation Warp Speed and other medical and scientific professionals are delivering to us. I'd also like to just say one thing, and that is a particular thanks to our hostess, Erica Schwartz, who has done a fantastic job. I'm old and not all that tech savvy, but she's been texting me repeatedly, and I'm learning a lot of things this morning about how you type and talk. But in any event,
sir, that's Erica Watson, not Erica Schwartz.
Excuse me, thank you so much. Erica Watson, and I do know the difference. And if her picture was up in front of me, I would be able to say that, but she turned it off a long time ago. But thanks, Admiral Schwartz. I appreciate that. Erica Watson, and I have that written down plainly in front of me, but I said it wrong. But in any event, at this time, I'd like to say thanks to everyone, and thanks to Dr. Taborn and everyone that put this particular conference together. And with that, this has been a terrific panel with a most informative presentation, and I thank you very much. And we're out here.